Okay, hi everyone. Is that too loud? Okay. Good, let's see. Welcome everybody. Today we're going to talk about evaluating the health literacy environment. And I promise I'm not going to talk at you with slides the whole time. We're going to have a brief introduction, and then we're going to go through an activity together, and then we'll come back and debrief afterward. And so by the end of this session, participants should be able to identify some key elements of a health literate environment: physical, digital, and interpersonal. We want to evaluate barriers and opportunities across patient touchpoints and develop actionable strategies that support quality, safety, and equity. So, what is a health literacy environment? This includes all of the ways that an organization makes it easier or harder to communicate effectively between people and teams, navigate physical spaces, and access and use digital tools, which of course becomes more and more a part of our lives. And our goal here is really simple. It's to design systems that work for patients and care teams, rather than having us need to adapt to a system that's constantly failing us. And one thing that I've been enamored with a lot lately is systems thinking. My training is as a design thinker, and systems thinking is a complementary view. So design thinking is really focused on the user, on the person at the center of the work, and systems thinking is really focused, exactly like it sounds like, on the system. And one thing that I think is really helpful is to kind of understand that the continuum of how systems appear to us. And so if we think about a simple system, that could be something like a hammer, right? It pretty much has one use. Versus something that's complicated or complex, which would be like a coral reef, or an airport, or the human brain, or a health system. And those, of course, are both complicated and complex, as you see here. And what that means is, in the complicated sense, we have both political decision-making and judgmental decision-making that need to occur, which means that there's, in some ways, danger in the environment in terms of how relationships appear and whether whether we're trustworthy or not, right? So there's an emotional component to things that are complicated. And whereas complex means that there's a network within a system that has a lot of different parts to it that all need to work well together in tandem in order for the system to be effective. And so a lot of times, for a lot of the reasons that Cliff and Dawn and our keynote speaker today mentioned, we're working in a system that includes both things. And you can see that when there's a lot of agreement, things can often be simpler for us, or a lot of certainty. And we know, especially for patients as they're navigating the health system, that idea of uncertainty can be really difficult. It's one of the hard things about being in a space that is not your expertise, that really matters for your own personal health or those that you love. So, understanding the ecosystem that we're working in and being clear about that, I think, is really important. So one of the things that I know, I actually think Cliff is the one who introduced me to this guide here, is there's a health literacy environment tool that's available to everybody, and I put the link here in the slides, and I believe we'll share these with you. And this is a guide that will help you in your space ask questions about how we're building a health literacy environment or a health literate environment or not in our organization. So it covers things like organizational policies, institutional practices, navigation, culture and language, and communication, so print materials, forms, websites, and patient portals. And I actually think I got to be an early user of this. And you can see that it has a really clear rubric where you give scores, and you can walk through and see where there are gaps and opportunities within your organization. So I'd really encourage everybody to leverage this as a tool. And I think it's a really good starting place for a lot of conversations. And part of what I want to talk about today is what to do once you've been through this exercise, which is to dive deeper into specific journeys where we can help people. But this in particular is really focused on understanding, again, like the system that we're working within, so that we can then think about that complexity that users or patients or whoever we're happen to be serving are encountering. Okay, so today what we're going to talk about and try out is journey mapping. And journey mapping is a design thinking activity. It's a tool. And what it's meant to do is make people's experience within a system visible, and centered on them, on the people that are being enmeshed in that system. And what a map usually includes, and there's all sorts of different ways to do this, is steps or stages in a process. And sometimes people demonstrate this in a linear fashion, and sometimes they really capture that something can be circular, or it can be haphazard, or it can go in all sorts of different directions. And it also usually is going to capture touch points, so physical and digital. So the Health Literacy Environment Guide is focused on helping you see and understand whether those touch points are appropriate, and we also want to be able to see how people are encountering those touch points within a system and within a journey. So it's really important from a design thinking perspective to always place things in context. And one way that we talk a lot about on our team of people encountering the work that we do, so I come from the brand marketing and communications team, we may have one team that focuses solely on the website. But we also know, for example, that people are probably not going to use the website to get to us. They're going to go into Google Maps and type in an address, and there's probably going to be patient reviews associated with Google Maps, and so they're going to get an impression of the kind of care they're going to get, as they're getting instructions in their car. They may have seen something on our website, but now we have AI snippets that show up in Google search, so they may never come to our website the way they would before, right? There's a whole lot of context in terms of how people get information that changes over time, and we want to be thinking about all of that together instead of solving little problems in silos. Not that solving those little problems in silos is a bad thing, but the connectivity of it is going to help us make the system itself smoother. So usually then in a journey map, you're of course looking for barriers and then the bright spots. So what is working well? Can we do more of that? And what isn't working and why, and who's involved in the process? We also want to capture, if possible, emotions. Emotions are a significant clue to where things are working or falling apart, obviously. I'm sure everybody has been frustrated having to work within a health system before, and that's something that we see captured quite a lot. And then we also, and especially today, this is part of our theme, is focusing specifically on those impacts of quality, safety, and equity. So when we find those barriers, what gap exists there that then, to our earlier speaker's point, makes it that someone doesn't have as good of outcomes, or that they don't understand how to take their medication properly, or they don't really understand what they're consenting to, for example, as well. Okay. So there are all sorts of different kinds of journey maps, and there is no right or wrong way to do this. And this is a tool called Miro. Does anybody use Miro these days at work? See Hans over there? Okay. This is a digital interactive tool that we use a lot on our team, and you can see there's 390 journey map templates on here that you could possibly use, and they all work for different circumstances. My favorite way to do journey maps is really in person whenever possible, and that's what we're going to do today. I think it's the conversation with each other is richer, but this is also something that you can do in a digital space. One thing I want to really highlight here, and this goes back to Dawn's talk, is that whenever possible, it's really important when we do journey mapping to try and have the user, the audience, the patient themselves as part of the process, right? It's always it's going to be beneficial anyway if that's not possible for whatever reason, but the best case is to have the people you're serving in the room walking through this with you so that they can tell you what their experience has been like. And one story I have about this is when we went through the health literacy environment workbook one time with a patient from the Center for Women's Health. Walking through the physical space was really interesting with her because in that clinic there was like a kiosk where normally somebody would sit and help you, But they didn't have staffing for that kiosk, and it was empty, and they hadn't used it for years, they said. But for her, it felt unstaffed, and like there wasn't someone to help her. And so even a decision about a built environment way back when the architects were drawing up those clinical plans had an impact on how that patient felt about whether she was getting the help she needed however many years later. So journey mapping can happen, like I said, on a digital screen. We're going to use Post-it notes today. You can do an actual walkthrough with people through a full journey. There's all sorts of different ways to do this. And some examples I wanted to show you are from one of my favorite books called Health Design Thinking. And this was a really interesting collaboration. It's Thomas Jefferson University and Ellen Lupton, who's a renowned design writer. And they partnered with the Smithsonian and Cooper Hewitt, which is this really cool design museum in New York. And they said, how do we use design thinking skills in health systems to create better products and services for people? And so this is an example of a journey map that's kind of like I just mentioned, where its architects are using it and they're walking through a physical space to see whether that works for patients. So Banning, who's our VP of Patient Experience, who's doing another breakout session right now, he and I are on our interior design committee, and this is the Interior Design Advisory Group, working on Vista right now, and this might be something that we would do in that context. And then here's another journey map that some people did for a wearable treatment hub. And this was a workshop that they did at Thomas Jefferson University, and they were working through this question here about diabetes and this bracelet that she could potentially use. And so you can see they've used pictures here and walked through a process. And then this is an example of working through a labor and delivery flow and what that may look like. So you can see that this is trying to capture kind of the full journey, not in a linear fashion, but more as a flow chart to help them understand, again, where there might be barriers and where there might be opportunities. And then this is one of my favorite examples. This is a double-decker story, this journey map that they created, where they're identifying clinician stress, the clinician journey, the clinician thoughts, the patient stress, the patient journey, and the patient thoughts. And you can see this is walking through making an appointment, checking in, the nurse assessment, and meeting the clinician. But they've really identified that those thoughts and stress are important for them to understand and learn about so they can improve the process. And so they worked on tracking those things in that linear journey, which I think is really fascinating. Okay. And so a journey map in this sense helps visualize the experience of a person over time. And it helps us find gaps in experiences and explore potential solutions. And journey maps make intangible experiences visible and facilitate a common understanding between team members. So you can see at the top there, I've used the term boundary object, and that's of course some jargon that I will explain. And that's that when people have different experiences and we sit them next to each other, we need something for them to gather around in order to understand that shared experience better. And so a boundary object is something that, a patient and a care team, anybody involved in this journey can come together around to use as a shared source of understanding. So it helps us see, make visible what other people are going through and start thinking about problems together in a shared way. So that idea of a boundary object is one of my favorite ideas. And then another reason that I think journey mapping is a really helpful solution when we think about the health literacy environment and how to evaluate it. This is from one of my favorite books called Brain Rules, is because we don't pay attention to boring things. And whenever possible, I like to have opportunities to get people out of their usual space and do something that feels different and that's creative because it's fun. It sends a signal that we're going to think about this differently. It allows us to open up our minds a little bit, move outside the status quo, and then therefore have more openness to the experience that somebody who's not us has as they're walking through a journey. So a journey map is an opportunity not only to understand the user of a journey better, but to do better work together as a team. We don't have a lot of opportunities to do this. I mean, maybe you do in your teams, I don't. In my team, we don't get as many opportunities to do this. All right, so what we're gonna do today is we're going to try mapping a journey. But before we do that, I wanted to ask, are there any questions or clarifications that I can give you about journey mapping and what that looks like before we start? What questions do you have is what I should ask. It's kind of a little hard to see. Okay, I'll walk around and come visit you while you're doing this. So it's okay if you don't know quite what they are yet. Yeah, Cliff. In some places, yeah, in some places we are. I know Hans is here from our Office of Digital Health. You do journey mapping frequently, don't you, Hans? No? All the time, yes. Yeah, and we do too, and we'll talk about that more. It depends on what we're working on. I think there's a lot of opportunities to do this better across teams. And so one really example of this, of why it's really important, we were doing some ED journey mapping work that unfortunately we didn't get to finish because we lost to layoffs the folks that were doing this work. But we were working through what the ED journey is like, and we had folks from across the team there. So visitors and volunteers, environmental services, the nurses, I'm not going to get all the terminology right, and the triage folks. And every single one of those people who came in had a different perspective that was fascinating to me. Like the environmental services people, we were talking about how people get really tired and they need somewhere to sit, but they have to have chairs that are wipeable because often people come in and there are all sorts of things that could be potentially unsafe or unhealthy for people, right? And then the volunteers had a whole other different experience of what it's like to be a volunteer in the emergency room, and they noticed entirely different things because their role was different. And so having, I think a cross-representation across teams of whoever is involved in that journey as much as possible is really important, not to mention the patients that's actually going through the process themselves. The insights that come out, kind of the light bulb moments for this, for me, is always really incredible. Okay. It's a little hard to see you and get how you're feeling from up here, so. Okay. So what we're going to do is we're going to split into groups of about 4 to 5 people. I'd encourage you to meet somebody that you don't know. And I have a bunch of Post-it notes and some Sharpies up here. And I thought we were going to be in a little bit of a different room, but this will help us be creative and we'll make this work. And what you need to do is agree on a simple journey to map, and I'm going to give you some ideas in a second. And you should have some familiarity with that journey. And right away, we may not have our user in the room, but you may be that person. I know I'm a patient here as well as my regular role, and so think of something where you have some lived experience you can bring. And then we want to identify barriers and opportunities as you work through this journey. So we're going to map this journey out together. I have some examples of what this can look like that you can have with you in case you want to start with it, but you're welcome to be as creative as you want. If you want to, build an architectural rendering or whatever you want to do, you're welcome to. And then we want to mark any potential impacts to quality, safety, and equity as you move through this process. So as you're talking about a specific touch point or moment in the journey, try and identify, if such and such happens, is there an impact here? And then at the end, we just want to be prepared to share one key barrier and one improvement idea. Okay, so some example scenarios here, just to kind of get your creative juices flowing. You may want to map out somebody who's trying to schedule and prepare for a surgery. You may want to map out navigating to and parking for a new primary care appointment. I know I had a new doctor a while ago and I had to do it and it was very stressful. Finding and choosing a new doctor, how would you go about doing that? Where are you going to go? Committing to being a subject in a research study. What makes you decide that you want to do it or not? Managing multiple medications as a caregiver for an aging parent, accessing interpreter services, or transitioning from inpatient care to a skilled nursing facility. And you may have whatever journey you want to do within your group is fine. Okay, so I have Post-it notes up here. Are you comfortable splitting in your own groups, or do you want me to count and we can assign people randomly. Count? Okay. All right. Yes. So let's see. I'll just start. Clifford, you're going to join? Okay. 1, 2, 3, Larissa. 4, 5, 6. Wait. Oh my gosh. What are we doing? I've got to start over. Thank you. So how many people are in the room? Why don't we do 4 people in a group? I think that'll be good. Sorry about that. Okay, let's do it again. 1, 2, 3, 4. 1, 2. Oh, you can't? Sure. Thank you for solving problems. Yeah. You'll just make your own? Okay. We'll figure it out. Thanks, everybody. Come on up and grab your stuff. Okay, so this is an example that you can use, but you don't have to. And here's Sharpies. Grab however many you want. Yeah. And you can take, different colors if you want to represent different things. Yeah. Got it? Okay, there's a map. Sure. Yeah, sure. I'm hoping we have enough. Sharpies. Yeah, take a couple. When I'm high. Here's an example. You can kind of see how they've done it. You don't have to use it, but if you want to, you can.
Should I take 2?
Yeah, just for your other folks so they can write.
And one of every color?
If you want. It's nice to have different colors, I think.
Or how many colors would we? Can I have an example?
Oh, yes, you bet. There's an example.
I'll leave the one.
An example. You don't have to do that one, but you're welcome to. Oh, yeah. I forgot to say that I thank you to, what's your name? To Joe for raising this. I have big sticky Post-its that you can use to put your sticky notes on, or you can just line them up on the wall, but just be really careful not to write on the wall with your Sharpie, so it's probably good to come and get one of these. There should be plenty. You can come sit on the stage. You can do it on the floor, however you want to do it. Okay, everyone. I'm going to ask you to finish your thought. And I know there's a lot to talk about. If everyone can turn and look this way, that would be great. I love that everyone wants to keep talking about this. So I know this is just basically like a Costco sample of a journey map, right? You've got like a tiny little taste of a journey map. But I just want to walk through and just get just one theme from each group and one barrier and opportunity really fast. So, what is one thing that you noticed by doing this, and what's one barrier and opportunity? And I'm going to put this group on the spot to go first over here and tell us what your journey is just quickly.
Okay, we modeled the journey of parents bringing a child in for an MRI at Dornbecker. So kind of what they expect before arriving and what their arrival situation is like, and then how the procedure would go and what they would follow up as our main buckets. Can you remind me what the other? Okay, a theme, I would say a theme was expectations and what they would expect in terms of what their prep was and how that set them up for what to expect in the procedure, which is something they wouldn't be familiar with before, and then what to expect in terms of when to get results and what to expect in the procedure itself. A barrier is that I think patients feel a lot of anxiety about a procedure like this and what the findings could be regardless, and it can be kind of a traumatic experience in the moment. because having an MRI for kids requires sedation. And finding a vein in a child is very difficult to do, and that often requires a lot of attempts and usually is very stressful for the child and family. So how do you set people up for the expectation that that's possible without creating even more anxiety around something that's already very stressful for the family? And then the last thing was, okay, perfect.
Thank you so much. And I love that you identified emotion as part of this, right? And that really guides, I find emotions to be very clarifying in terms of steps. When we do work on our team, we use things called descriptors, where how do we want people to feel as an adjective, and that can be really clarifying. So I appreciate you saying that, thank you. Okay, let's go over here. And just tell us maybe one thing you learned and then a barrier or an opportunity, just so we have enough time.
So we're looking at research protocols and how going from pre-screening to consent, kind of the process that happens, and kind of what barriers you might happen, and kind of how to address some of those along the way. We kind of thought really big and kind of made it more complicated than I think we needed to, but we settled on looking at pre-screening, patient identification, patient outreach, patient scheduling, and consent as our kind of journey map. One barrier that we were looking at, well, a couple of ones we're looking at the patient identification and kind of thinking about early understanding of what kind of pieces they might need to conduct consent, whether it's a language barrier, a traditional or non-traditional work schedule, or whether you need to have an interpreter there, or whether you need to have parents there if a kid's being assented to a study. So we're looking at some of those ideas and thinking about those to kind of set those in place to make the consent more successful. And I think that one of the ways that we're looking at improvements would be kind of regularly meeting with the PIs of studies to help make sure that we understood kind of who would be involved and who would be there at either like a clinic to do consent, if that was where it's happening, and then also kind of the tools we need to identify when the patient needs at the consent visit or for scheduling.
Thank you. I heard you identifying a lot of equity impacts with this decision. Yeah, thank you. That's really helpful. Okay, let's go to this group here.
Hi, so we did the process of scheduling a surgery, and we also encountered a lot of themes of emotion, specifically just feeling really overwhelmed. And so even not thinking about the scheduling itself, we thought a lot about how is this person just feeling at home? We were using the example of someone who has to have a leg surgery, and so they're not able to do activities of daily living. And so do they have someone who can help them? Can they afford to take time off work? What if you're in a position where you're feeling really overwhelmed and you don't have the care that you need at home, how can you even focus on scheduling a surgery or getting that care that you need for yourself? So that was one of the barriers that we identified. And so for a solution, we were thinking for the scheduling services or the clinic, instead of waiting for the patient to ask for that help, offering that help and maybe just reaching out, checking in and saying, hey, we understand this is a really overwhelming process. This is an overwhelming time in your life. What can we do to help? Can we help you fill out some paperwork for leave? Can we offer you some resources? Do you have help with transportation? Do you have someone at home who can help you? So that was one of the things that we were thinking about that really had nothing to do with scheduling the actual surgery at all, but I think is equally important, if not more important, because the surgery never gets scheduled if you don't consider those things first.
Thank you. That's so interesting, and especially that you identified something outside of where you intended to start. And I always think that's a really interesting part of a journey is it takes you places you don't necessarily intend to go, which is because you put yourself in someone's position to determine. Great, thank you. Okay. Group over here. They're all like, not me.
So similarly to the last group, we also centered on themes of capacity and personal capacity and institutional capacity, but we started off our journey thinking we were going to map the entire process of establishing primary care for a young child in your care. And we ended up really spending a lot of time on the mechanics of getting to have even scheduled that appointment. And so I think that one of the main barriers that we identified was having the emotional capacity, the functional capacity of internet access and internet savvy to know what sort of resources you're intaking to make this decision. So that was a barrier that we identified. In terms of opportunities, I think, in that double-edged sword way, the internet is an opportunity and a barrier, right? So the amount of information that's available to people to make these decisions and the time that they have to make these decisions is also an opportunity in establishing primary care.
Thank you so much. I know this is something that, again, reiterates the need to think across teams. Like, for example, our team, for us to understand if someone is even taking patient appointments, we have to have data from all over the organization, right? So the website could be wrong, all sorts of things. We're at time. Okay. Like I said, Costco sample of a journey map. Thank you. I hope this gives you an idea of what it's like to put an audience, a patient, a user at the center and start walking through what they may encounter as barriers or opportunities. I would say anytime you are encountering a problem that's complex and across teams especially, this is really helpful to just clarify for people. One last point here is that I started here as a designer, and one of the reasons I started thinking about health literacy was because I would design all these brochures all the time. And I thought, does this help anyone? No, it doesn't usually, right? They need very different help than a sign in a clinic or a brochure. That's not what they're looking for. And so this really helps us think about health literacy in the sense of not just the language we're using maybe in a printed piece, but whether that piece is actually the right way to solve a problem for someone's needs. So I will send you this deck. If you have any questions about how to do this, please reach out. Hans and his team do amazing journey mapping and Office of Digital Health. So thank you for your time, and I hope you had a little something you can take away today.